So, good evening, everyone, and welcome to tonight's Facebook Live discussion on vaccine confidence. I'm your moderator, Dr. Miranda Ward, and I'm also an associate professor and director of equity in the Department of Clinical Research and Leadership, which is in the School of Medicine and Health Sciences at the George Washington University. Before I turn things over to formally introduce my panel, I actually want to tell a little bit more about myself. I'm actually trained as a social behavioral scientist with research on youth identity, HIV, Black women's health, and all of my research sits at the intersection of racism, identity, stigma, and health. I also lead a national training model on how clinicians can routinize HIV and COVID-19 screenings in the primary care setting. So this is why I'm really excited to moderate tonight's discussion with Dr. Wolin and Dr. Brooks. But before we get started, I do want to first thank Dr. Ashanti Carter and Asia Bailey, as well as blackdoctor.org, otherwise known as BDO, for hosting this much needed and, I must say, timely discussion to address concerns about vaccines, really just improve public trust, and really equip all of us with the strategies to communicate with greater confidence about our vaccine-related questions and concerns. And ultimately, what that'll do is just improve our vaccine literacy. Of course, I have to thank our sponsor, Moderna, for this vaccine confidence discussion. And ultimately, there are a couple of objectives that I'm hoping that we get out of tonight's discussion. Let's enhance our understanding of vaccine science, vaccine safety, and maybe even vaccine development, including mRNA technology. Of course, we have to have a discussion on vaccine misinformation and disinformation, and then we'll focus on building our communication skills so that we can engage with a range of communities and audiences. And doing that, we know that that relies on multi-sector collaboration, right? So it's not just healthcare workers, but also it's educators, policymakers, community leaders, you. And so with that, I do have an esteemed panel of speakers that's going to help us do just that. I have their bios. I definitely want to take some time to read that so you know exactly the expertise that they'll be weighing in on. First up, we have Dr. Oliver Tate Brooks. Actually, Dr. Brooks is actually my Morehouse brother. So I graduated from the illustrious Spelman College, class of 2002, and he has an undergraduate biology degree there. But right now, he serves as the Chief Medical Officer and past Chief of Pediatric and Adolescent Medicine at Watts Healthcare Corporation in Los Angeles, California. He's also a medical director for LA Care Health Plan, which is one of the nation's largest Medicaid managed care plans. He's also the immediate past president of the National Medical Association, known as NMA. And he's a present board member and past president of the California Immunization Coalition and chair of the Immunize LA Families Coalition. In the height of, the pandemic in 2020, he joined the advisory committee on immunization practices COVID-19 work group and allowed for, making recommendations regarding the priorities around the vaccine. He also joined the Health and Human Services COVID-19 Vaccine Task Force charged with developing the release of the COVID-19 vaccine. And ultimately, he's now co-chairing the California State COVID-19 Vaccine Development Work Group, charged by the governor with determining the allocation of COVID-19 vaccines across the state of California. So that is Dr. Brooks, and he is joined by Dr. Todd Wolin. So Dr. Wolin is the executive director of the Trusted Messenger Program, which is part of a public health nonprofit called Public Good Project. He's been a vaccination advocate for over 30 years, which includes work as a clinical vaccine researcher, immunizing pediatrician, immunization confidence and communication researcher. And his work really focuses on educating healthcare providers to use communication best practices to help people reach personal evidence-based health decisions, which can only drive quality outcomes. His work has been covered in the LA Times, the New York Times, Science Times, the Guardian, and a range of print, digital, podcast, and documentary media formats. In 2022, Dr. Wolin actually received the American Academy of Pediatrics Holroyd Cherry Award for Outstanding Media and Public Health Work in the areas of advocacy, legislation, research, and professional and public education and Right on in. I think it's really important.
Dr. Ward, we're losing your sound a little bit.
Yeah, it cut
There.
out for a little bit.
Okay. Can you hear me?
There you go.
Yep, now
Yes.
we're good.
Okay, perfect. I don't know what's going on. All right. So I think it's really important for us to just jump right on in. I want both of you to answer these opening questions around the context around vaccine confidence and just really kind of exploring trust. So here we are in 2025. Why would you say vaccine confidence still is such a critical issue?
I'm happy to take a first shot at it. So first off, I'm honored to be on. Thank you guys for having me back. I do a lot of work around social media, a lot of work around communication. So to answer the question about why is confidence still an issue, I mean, I would say sadly, the polarization around science and vaccines has worsened, even in just the last 6 months, 7 months, 8 months since I was on. And that a big piece of that, for the first time in all of our histories, is really seeing the politicization of science and healthcare. This is something that never happened before. Like, when new vaccines, like I remember watching videos when the polio vaccine came out and people were like arm in arm marching down the streets. They had the March of Dimes going on, and people were just thrilled that their kids weren't being put at risk. And that pretty much followed through with almost all vaccine recommendations. It was always a kind of a bipartisan thing. It wasn't controversial. What's happened is what we've seen, as nasty as politics has gotten in the last couple years here, is that we see some groups using science and health as a leverage point to attack other people. And that doesn't help anybody. I would just tell you, in our own organization, we're about building a bigger tent. We are where we are right now in 2025 because scientists and healthcare providers apparently did not appeal to a broad enough swath. Like we say, I don't want to appeal to the extremes on either side. I want to get the left. I want to get the left center, the right center, and the center. Because the majority of people want their kids vaccinated. And Oliver can tell you that too, right? We have data showing that Democrats, Independents, and Republicans all want their kids vaccinated, the majority, as well as adults.
So some of it is that we are a victim of our own success. We didn't even see measles until recently. As a pediatrician for 35 years, I didn't see measles. Diphtheria, polio, we had some of that last year before in New York. These conditions were eradicated, so people got complacent about vaccines. You mentioned disinformation and misinformation, and Dr. Wallen can clarify, but I look at misinformation as people that are misguided. The information now coming out from the CDC about thimerosal, mercury being in vaccines, that's clearly misinformation. We litigated that 20 years ago. There's no issue with that. Disinformation to me is people are purposely putting information out there to dissuade people from getting vaccinated. To be quite honest with you, I'm not sure why that is happening, but we do know that we need to address it and confront it. Todd, Dr. Wallen made a good point. 90+% of people want to get themselves or their child vaccinated. For children, for sure, maybe a little less for adults. So we really need to look at that. And you said still here, I remember when the HPV vaccine came out in 2006, people, there's a vaccine for sex. So there was a little pushback, but within a year, I really wasn't hearing that anymore. So vaccine hesitancy really had more or less gone away. It certainly wasn't in the mainstream as it is now. Something changed. Influenza seemingly was the one where I started getting pushback as a practitioner. And then with COVID. And then for some reason, it seemed to be politicized. So I do agree with Dr. Wallen that it is become politicized. The statistics show that the lowest rate of COVID vaccination is in the rural areas of the country. And the rural areas of our country tend to be the most red, the most conservative. So not even, it doesn't have to do with education. It's not truly about income. It seemingly is political persuasion.
So when it comes, I love that you clarified that actually the majority of people in this country, 90% do actually are in favor of vaccines. So when it comes to that 90%, who should patients and communities look for credible advice around, the recommendations for those vaccinations?
Well, let me start with that one, Todd, for two reasons. One is I want to make a little correction on my bio, Dr. Ward. I'm retired from my work at Watts Healthcare Corporation. Number one. And then number two, I was on the Advisory Committee on Immunization Practices, the ACIP. So that was the committee that RFK Jr. terminated on June 9th. So I was knee deep in it. So I know exactly what's going on. So had you asked me this question on June 8th, or maybe May 8th before RFK Jr. took over, I would say trusted messenger, first and foremost, is your doctor. But your doctor's busy. It's hard to call your doctor and say, well, tell me about influenza vaccine or MMR vaccine. So beyond getting to talk with your doctor, I would have told you, look at the CDC. The CDC had very credible, excellent, detailed on one level, and for a layperson on another level information. And it was there, and it was accurate. I was one of the ones that helped provide that information. I'm not saying because I did it, I'm saying that I can vouch for it. Now, I would have to say you cannot look to the CDC for credible information. I was looking up something, I can't remember exactly what, and when I went to the link, it said this information no longer available. So the CDC is actually taking down, removing information. So I'm going to let Todd speak on this, and then I'll tell you what I really feel the answer is in terms of where we now need to get our trusted information, because he's Dr. Trusted Information.
I would 100% just agree with everything Oliver just said there. Like, that's where we would always point. We would always list the CDC as one of the top, because they had such a rigorous and robust evaluation protocol to any evidence that was ever put up on a site. You knew that it was, like you said, 17 experts with decades, all coming from different angles. Some were vaccinologists, immunologists, primary care, communication researchers. I mean, experts with decades. And now, Oliver, I can't remember the people they have on there. There's like 7 or 8 of them. I think
7.
And
with little experience in vaccine. One is an ER doc whose experience is that I've taken care of patients in the ER.
Yeah.
That was literally
and I happen to be, as a medical student, able to catch one kid I almost dropped, but I should not be delivering your babies professionally, right? I mean, there are people that spend decades becoming professionals, and this committee, these were all renowned people. It's very hard to get on that committee. It's very prestigious to get on those committees, because they bring the heat in terms of understanding the science behind what's going to get approved, because they know they have people's lives, kids and people's lives in their hands. So who should be your trusted messenger? Well, I will again agree with Oliver that your doctor hopefully is up to date and a good resource. We certainly know there's some healthcare providers out there that are less informed or might be misinformed themselves. But for the vast majority, I would say healthcare providers and your healthcare provider. And if you look at data, while trust is eroding in almost every aspect, this can include corporations and bankers and lawyers and everything else. Trust in healthcare providers still stays high. It's eroded a little bit. Nurses actually at the very top, but trusting your doctor actually is going up. So a discussion with your own healthcare provider, and it could be a physician assistant, it could be a nurse practitioner, of course, but that's a good source. In the current situation that Dr. Brooks described, we are now seeing that medical societies, professional medical societies, are now trying to step into a space to provide clear guidance. Now, what I can tell you as a pediatrician and as pediatricians, the American Academy of Pediatrics continues to bring a very rigorous approach to how vaccines are recommended. And they are actually, in spite of the ACIP going through these changes, the AAP has had this process in place even before the ACIP came around, which is I think it's the Council on Infectious Disease that makes these evaluations and recommendations, right, Oliver?
Yes, and that's true. And they published something called the Red Book.
Yeah.
That's been around for decades that we have used as a reference. So first of all, I would say, as it relates to the president of ACIP, it's nothing personal, honestly. I was let go for whatever reason. They said that we had conflicts of interest, which we didn't. However, if they put in place another set of experts, I'm good with it, honestly. So in light of the fact that we cannot at this point trust the information from the CDC, what Dr. Wolin said is accurate. So the American Academy of Pediatrics has their own recommendations and best practices. The American College of OBGYN, ACOG is what it's called, they have their best practices for pregnant people. AAFP, American Academy of Family Physicians, they have their own guidelines, their best practices. American College of Physicians will have them also. So for me, right, and the problem is the public really is not that well aware of these groups, understandably, because you didn't have to be. But right now, that would be the most trusted place. I'll tell you one other place, though, generally speaking, will be your state, county, city public health department. So I live in Southern California. So LA County Public Health Department, I trust the information coming from there. I can't vouch all over the country for every public health department, but in general, the goal is to take care of the public's health. That's what they call the public health department. And vaccines are, generally speaking, for the public's health. So they serve dual roles. Vaccines keep you and your family healthy. But if we have enough people vaccinated, there's a certain line for herd immunity or community immunity, with measles somewhere around 95%. Other vaccines maybe 92%. If you and your neighbors to a 95% level are vaccinated, it can't spread. Because if I walk in a room and I have measles, which by the way is the most contagious virus on the planet, if 95% of the people in the room are immunized, and that one person may get it, but then they walk into a room, 95% of the people are immunized, one person get it, it can't spread. But if you say 50%, 50, then it mushrooms out.
So let us move on to talking a little bit more about unified messaging and more specifically the mRNA technology. So Dr. Wolin, I know you talked about the importance of, us establishing a medical home, having a PCP that we can, talk to with our questions about vaccinations. But I actually have a question about some of those other trusted messengers, right? Because as you know, when it comes to public health, in public health, we relied on the barbershop, right? We relied on the, faith leaders. So can you tell us a little bit about, who are some of the other trusted messengers? I mean, we have the long, litany of scholarly academic organizations that the average person doesn't know about, that they're not looking up their website, following them on IG, right? So let's talk a little bit about some of these other trusted messengers working alongside, or who at least should be working alongside healthcare practitioners, and how they really can work together to deliver one unified message.
Sure. Yeah. What I would tell you is when we talk about trusted messengers, at least in our program, we're talking about docs. Those are both MD and DOs. They're also nurse practitioners, physician assistants. They're nurses, medical assistants. They all play a role. Clinical social workers play an important role. And very important down to the level of the community and community-based organizations or community health workers. These are people oftentimes trained by the health departments that Oliver just mentioned, and who are really good and trusted because they are in those communities, oftentimes speak the same languages of those communities and look like the communities because that's where they shop and they worship and they do everything. So they have I'm not the appropriate messenger for every community, that's for darn sure. but we want to make sure that, that people have the adequate training. As you said, the trusted messengers expand beyond that. Paramedics in the community can be a trusted messenger. Librarians, people trying to look up information. Now, again, you got to make sure, have they had the training and orientation to the science of the topic? But usually, like, a librarian will be like, I don't know, but here's a resource that we use. So those are other people. Like, I know certainly when I've looked at Collective Impact, and I've done a lot of that work around breastfeeding, because I was also a lactation consultant for 25 years. But like you said, barbershops, bodegas, anywhere where there's like community gathering spaces can certainly be. But you got to make sure you have the expertise on the subject. That's why community health workers are such powerful allies.
Absolutely,
and Dr. Ward, as I'm thinking about this, and as we talk about it, those are trusted messengers. Let me use another term, though: amplifiers. So, for example, if Magic Johnson got on TV and 30-second look, everyone needs to get their flu vaccine because you don't want to get the flu. You don't want grandma to get flu. The vaccine works, and it's that simple, and it's safe and effective. Mm-hmm. He's not an expert, but he's an amplifier. Mm-hmm. And influencers, let's say, on social media, if we got people that have 2 million followers, or they get 100,000 views or something, those people can be amplifiers. I think the problem is that there are some of those that are giving
the wrong
this or this. I don't know what you want to call it. True, wrong message. Right. Exactly. So we have to counter that. One thing, I just came from a conference. We were talking about this. So you hear something on Instagram, don't get that COVID vaccine because it makes Black women sterile. So say that. See, I heard that. Okay, well, tell me the reference. Like, what was what was the source of your information? So it was, DJ Black Ice. Okay, so well, where did he get his information from? I don't know. So, if that's what people are getting, then we have to worry. But if Magic gets up there and he says, well, what are my sources of information? He said, I know Dr. Brooks down there in LA, or before they had me even do this, they showed me a one-pager, let's say, of the safety and efficacy of the vaccine. So we need to really watch out what we see. But my feeling is that something like this, neither of us, well, Todd may be an influencer. I'm not. I don't have 100,000 followers, but I do have an MD degree, and was on it.
But you're an expert,
so
right?
You, BDO, is helping to amplify the message by having a FB Live such as this.
That's right. And I love that you said one of those best ways to counter that misinformation and disinformation is source checking. Like, where did you get that from, right? Because that allows people to, like, where did I learn this? Sometimes you don't even know where you got that from. So it helps you start to do some of that digging and questioning. But speaking of digging and questioning, there's still many questions about mRNA technology. So I want to just back up and share in simple terms, Dr. Brooks, what exactly is mRNA technology? How does it work in vaccines like COVID-19? If you could just kind of share a little bit about that, because I know there's still some lingering caution and concerns about it.
Yeah, sure. So it was developed at NIH. One of the lead developers was Kismina Corbett, a Black woman that came out of University of Maryland, Baltimore. It was developed when we were looking at, I believe it was SARS-CoV-1, or an earlier version of the same virus, or a similar version of the virus. And basically what mRNA really simply is it codes. It's a blueprint. So mRNA is injected into your shoulder, let's say. It goes into the cells, and it goes to the mechanical working of the cell called a ribosome, which makes proteins. It makes a protein that the body forms antibodies against. So it goes into the cell. It says, make 10,000 copies of this particular protein. That protein is, let's say, a picture of COVID. Your body develops an immune response, says, we know this is something bad, and you get antibodies. That mRNA lasts, I don't know how long, not long. I mean, I think it's hours or something. It goes away really quickly. But it stimulates an immune response. So you get antibodies floating around, and these called cells, T cells, that when a bad thing comes along, let's say you immunize against COVID, if you get exposed to COVID, then your body is primed. They know, oh yeah, something told us about a month ago that this may be coming and it's bad. And so your body can then fight COVID. The vaccine was not made to necessarily stop you from getting COVID, although we hope that it would do that. It was made to stop you from getting sick from COVID, getting in the hospital, going to the intensive care unit and dying. Hopefully, maybe cutting down on the transmission some, but that's what mRNA technology is. It makes a protein that stimulates an immune response that keeps you from getting infections.
Okay. And what was the impetus for creating that type of technology versus, what we use in the flu, like the live or the deadened version of the actual
Right. Well,
virus?
one of the things, it's efficient. It
Okay.
works really well. It produces that one protein, if you will, one chemical that stimulates an immune response. But the other thing that makes it really nice, it's easy to adjust.
Mhm.
So we want to make a COVID vaccine that's mRNA. Okay, now we want to make a messenger RNA vaccine against RSV. So we can go in and change the blueprint.
Mhm.
Essentially, what mRNA is nothing but your DNA is a blueprint. Importantly, a side note, mRNA vaccines do not enter the nucleus.
Yeah.
All in your body, all the DNA, 100% is in the nucleus of a cell. The mRNA does not enter the nucleus. So, but you can program. But let's change the blueprint. Instead of making a protein that stimulates an immune response against COVID, let's program it to make a immune response against RSV. And that has been done. So it's elegant. It's funny because we're getting all this pushback about stuff that is like, to me as a doctor and one who treats patients, it's like a miracle. So, whoa. Oh, 20 years ago, you told me, say, okay, we can just make a blueprint on mRNA, inject into somebody, it'll stimulate their immune response, and they won't get sick if they get it. I'd say, nah, man, you must have read that in some science fiction novel. But it's just, I want the public needs to understand that this it's a biotechnology miracle.
And two things, and I can tell you, Dr. Brooks and I were probably both equally fascinated that we really didn't detect this virus in the US in significant ways until around March. Like, we knew retrospectively it was probably here in January, it was probably here before, but it was like March when everybody was hearing about it. And if you think about it, we had a functional, incredibly effective vaccine within like 6 months. And we started giving it to people in like December after the initial studies were already completed. That's insane. Like, that is crazy. And again, to Dr. Brooks' point, while the intention of this vaccine was never to stop all the infections, we knew people would get infected. It was like 98% effective at even stopping like those initial infections. But it's still, even after when the Omicron came and all those different changes came, it still continues to keep you, the vast majority of people that get it, keep you out of the hospital and from getting intubated and certainly from dying. The other thing that I will defer to Dr. Brooks on is this vaccine arguably is the best studied, most studied vaccine in the history of vaccines. I think the initial study was 70-some thousand subjects, which is enormous. That's on the largest scale. Like, I remember one other study, I think Rhoda, I think that was a 70,000 person study. But then we now have billions of doses that have been under extreme surveillance across the globe to continue to look for safety and side effects. And this vaccine still continues to hold up, like 4 years down the road, is an amazingly, amazingly good vaccine.
Yeah. So then
and I'll underscore that. Yes, absolutely.
Why do you suppose? I mean, both of you are part of the scientific community, so you can just, the efficacy and all the things, but the average layperson still has some lingering caution and concern about mRNA. Where does that come from? Like,
two things I would say is one is the key number one is this became a politicized issue. This is when science started getting politicized, and the disease itself, COVID, became politicized. Policies around COVID became politicized. Remember, mandates and shutdowns. So then the vaccine just got thrown into that. And by the way, this vaccine is the first vaccine I'm aware of that was being attacked before the vaccine actually came out. I can't really name another vaccine before it came out that was under full-scale attack. That's one thing. The other thing is everybody will play the newness card. This is too new. We don't know much about it. And then if you remember, the federal program to fund it was called Operation Warp Speed. Everybody said, oh, that's way too fast. And then again, to Dr. Brooks' point, we went from just starting to get the DNA sequence, the sequence of the virus, to a full-scale vaccine in a time that was much quicker. Now, it's not because this was an entirely new technology. To his point, you can trace this technology back to 3 and 4 decades, the beginning of this technology. So, and they were making it for MERS and other similar viruses. So this was literally like, we know how to do this. We just got to make a couple changes on the blueprint and we can just make it for this, which is why they were able to whip it up in literally 6 months.
Yeah.
So also, because that has also been a concern. How did you come up with this so fast? So the government promised the manufacturers that we'll buy 10 million doses. So they could go forward faster because they had money behind them. A lot of times you have to develop it. Then once you develop it, you have to market it. There are a lot of things that go behind it. Importantly also is that this vaccine, I forget the calculations. I think 6 million have died or something, but the calculations like we might have had like 20 million more deaths.
Yep.
So we don't hear that, the success part of the story. And to answer your question, this is where disinformation comes in. Todd said that the vaccine was being cut at, before it even came out. So what is that? That's disinformation. So that was politicized. So it's not really clear. I think it was that concept of individual free will, that how are you going to make me wear a mask? How are you going to make me not send my child to school? So, we have to kind of cut through that. I will also say that as one of the members of the National Medical Association's vaccine task force, we met with Moderna, Pfizer, and asked them the tough questions. We had the medical directors, those that developed it. Does it cause infertility? Are there things in the vaccine that are having people track you? Those are the things that we heard. So the answer was no, and we looked at the studies. And as Todd said, also, I think really, really importantly, all of these vaccines, they've been out, there are millions and millions and millions of doses given. If there was something truly bad out there, we'd know about it, okay?
And the issue of infertility was brought up, right? As we were just talking about some of the things that people are saying that are not true, right? But why does that stick around? And I will tell you what we call that's a zombie myth. They are myths that keep coming up. Where else we kept hearing people say, oh, infertility was HPV vaccine. Completely untrue. As a matter of fact, it does the opposite. It protects against infections from HPV, which can go on to lead to infertility. But why does that resonate? It's kind of like throwing pasta at the wall and see what sticks. Infertility scares the hell out of people, particularly parents of kids, of teenagers, or people in childbearing age thinking, oh my gosh. And what that ends up resulting in is something called inaction bias, right? I'm so scared that I will not do something that potentially could harm me. And otherwise it's kind of God's will and I'm fine. When in fact, every decision is an action, which includes not getting vaccinated. And absolutely, hands down, even as of 2025, we know for a fact, if you haven't had primary series for this vaccine, you need to be vaccinated. If you have comorbidities like diabetes, hypertension, chronic diseases, anything like that, you absolutely, or immunocompromised, you should be, vaccinated. It is the best possible way to be protected because this virus is still killing people. Like it wasn't killing people 6 years ago, and now there's like this many more deaths per year, and it goes up and down based on some seasonality. It's killing people still.
So what would either of you say to parents that, have read material that says that childhood vaccinations lead to autism in children?
Another zombie myth, right? So that's a classic one that started really in the modern disinformation era with a guy called Wakefield in 1998, 99. He's a guy that was completely discredited, lost his medical license, had 13 people in a lab trying to prove that 12 kids who already had autism, as he looked back, was the result of an MMR vaccine, or the measles vaccine and MMR vaccine. And it found out he had $1 million from a law firm trying to create some kind of link so he could sue. And in the meantime, he was making his own version. That was the funny thing, is he was going to make his own version of the vaccine. Discredited, lost his license. The problem is it got into people's heads.
It did.
And so even though I forget, Oliver, I think it's like 15 or 16 international studies with thousands and thousands of kids from all over the world who've tried to reproduce that, and none of them have ever, there's never been a credible study to show a link between vaccines and autism. But it's in everybody's head, right? Because the problem is that guy made it onto 60 Minutes, and his paper came out in the journal Lancet in 99. And that was the problem, because it took them a year to withdraw that paper and say it was fraudulent. The other 12 authors on the paper with them all admitted like it was fictitious. They made up the numbers and didn't know what to do.
So, you know what, Dr. Ward, what I would say to a parent, I said, it's not true. It's never been true. And I would tell you, you need to get your child vaccinated. One of the key components of vaccine hesitancy and dealing with someone who has hesitation is you have to go to where they are. So what is your concern? Okay, autism. Why are you even saying that? Oh, I heard that. Where'd you hear that? Okay, so look, I'm your doctor. I studied this stuff. Why would I inject your child with something I think causes autism? I don't get any extra money by giving this vaccine. I have no vested interest other than your child's well-being. So I would not give it if I thought it caused autism. And an important aspect of hesitancy, vaccine confidence or lack thereof, is ultimately is really important. People make those decisions from the heart and not the head.
That's it.
So giving them facts, I mean, what Todd said is accurate, obviously, all of it and more. I actually went to a event where he was speaking. And he looked bad. His eyes were red. But I said, well, there was that say said, and the key to science is you have to be able to replicate it. I can give you one study that shows you that tomatoes cause eye cancer. Okay. But can you replicate that? So I asked him, has that study that you're referencing ever been replicated? And he looked at me and he said, no. I said, okay. I had to get out of there because it was a room full of anti-vaxxers and I felt a little threatened. So I didn't go any more forward with it. But that's what I would say. You have to go to where they are. What is it that they're worried about? And also my feeling, if I can't convince a patient or a family or anyone within 30 to 60 seconds, then I'm done. So you have to appeal to what they're feeling, not what they're thinking. And you can do that.
100% everything that man just said.
Right.
Like, one of the things I've always said to families is there's nothing that I'm recommending for your kid or your family member that I would not
recommend to your own child, right?
My own kids.
Yes.
The second thing, absolutely spot on, and this is part of what we teach in the Trusted Messenger program, is people don't make decisions up here, right? Intellect. They make it based on values and beliefs. And so there's all this disinformation out there, absolutely, like delivering information that is hitting you here. Fear is the strongest one, right? If you get fear as an emotion hitting your values and beliefs, it's going to be tough sailing right there. And don't forget, like the magic thing about the internet was we were all supposed to get information that would be available at the tips of our fingers, but it brought us social media, which is horrible. And social media brings you your own little slice of hell. So if you're a Black family, you're very likely to get served up like Tuskegee imagery when you hear the word vaccine, or a Somali family where you're being told immigrants are being sterilized, or Orthodox Jews in New York where you're being told, the Holocaust has come back. This is their way to get back at you. Or you name it. Like, they will get, Midwestern Caucasian people freaked out that people are coming to take their liberties away. Like, you pick it, it will deliver scary information to you. The most important thing I can tell you, and why I'm thrilled to be in the Trusted Messenger program, is exactly what Oliver said, was he knows how to communicate effectively and can do so in, like he said, 30 to 60 seconds. He has a good sense of how to approach it or if it's going to work or not. Here's the problem. We are not losing any issue regarding the science. The science is clear. What we're losing is the communication around the science. And healthcare providers are not trained in communication. So the two things we do as healthcare providers when we come across somebody who's been impacted with inaccurate information is the two worst things you could do. We try and hit them with data because we're trained scientists. So we talk about data. And if I'm already nervous, giving me data right in my face is not going to help. Or the other thing that healthcare providers want is show me that picture with the book with the scary pictures. I want to show them what could happen if they don't do what I say. And if you try and approach somebody that's already concerned with fear and data, like our communications director says, you can't scare somebody out of being scared. You have to get down in here, find out what it is that impacted, where'd they hear from it, what do they think about it? And then, as Oliver said, then you can have an open conversation once you kind of move to their side of the table and listen. You got to take a moment to use active listening and build that trust that you have with them.
Yeah. So we've talked about HPV. We've talked about COVID-19, measles. Let's actually have a conversation about HIV while we're talking about combating misinformation. Could either of you share where we are with the HIV vaccine and what would you say, again, in clear, simple language on,
I'll defer to Dr. Brooks on that one.
Okay. Okay. Dr. Brooks, on why we are not yet at an efficacious actual vaccination, even though we had, again, people say we had the Operation Warp Speed, we were able to come up with the mRNA, technology for COVID. What about HIV? We've been working on this for decades. So what is your response to the science behind that?
So first of all, I always start off with, we are biologic beings. So bio stands for life. So we can do what we can do. And we take for granted, I think, people do robotic surgery. These vaccines are out now. When I was being trained, you really couldn't even treat viruses. People with hepatitis C died, period. Now you can treat him. I mean, I'm saying we're progressing to the point that people don't really appreciate what's going on because we're so used to it. HIV is a virus, the human immunodeficiency virus. It mutates, so it's hard. It's like a moving target. So it's been difficult to get a workable and effective vaccine. So I can't tell you. I would say we're years and years, okay? But what? When HIV came out, it was a death sentence. Now, HIV is considered a chronic disease. Are you kidding me? Again, it's a miracle. It's amazing where we are now. You all remember when HIV came out, it was horrible.
It was.
Africa, they called it Slims because people lost weight and died.
Yeah.
Here, people had large lymph nodes, pneumonia, and immunodeficiency. They got opportunities. They got infections that normal people didn't get. Now you take your medicine and you live. You live a normal life.
Untransmittable.
Yeah. Yep. Yeah, so unfortunately, the vaccine is a bit away from us for now. But in the interim, just take your medicine. I mean, so I'm happy to say that I can say that there's no vaccine, but there is an effective treatment.
And along those same lines, if you go back to mRNA technology, they're now creating and have created customized mRNA technology to target cancer markers. So when you look at things like melanoma and pancreatic cancer, like it's the same technology, just like Dr. Brooks said, where you can take sampling of what's the tumor that you're fighting, and you can find out the target on it and use the same technology where you can label it to fight a virus, to even use it to fight, cancerous cells. So the advances continue. The science isn't the issue. It's the communication around the science and the politicization and the polarization, which is where influencers are great. I think, sports stars are great, all that stuff. But at the end of the day, each healthcare provider serves around 1,500, 2,000, 2,500 patients.
Right.
If we all became better communicators, because none of us get communication training. Okay. And so when somebody comes in your room and you can see they've been impacted by inaccurate information, you make a recommendation and they don't accept it. Like I said, you tend to do those two things that makes it worse. If we could start making communication part of our medical school, pharmacy school, nursing school, pick your schools, if they would continue to train us and support us in residencies and as attendings when we're in our professional path, that would go a long way. I can tell you that Dr. Brooks and I both got thousands and thousands of hours of training on our stethoscope. And that only works like in certain parts of the body to diagnose certain things. And I got thousands and thousands of hours on my otoscope. And I had to study under Dr. Paradise, who had created the Paradise head. So I had to, and I could only use that on ears, nose, and mouth. But my communicoscope I use on every visit, but I got no training on my communicoscope. I had to like learn that and get lessons and learn how to communicate afterward. And as good of a communications as I hear Oliver is, I'm guessing you had to learn that on your own. You didn't get training on that.
No, not at all. It comes, I can say it comes naturally, but it took me years and years. So there were, for the first, let's say 7-10 years,
Mm-hmm.
you know, the information wasn't really getting to where it needed to be. But fortunately, again, we weren't at the point we had so much vaccine hesitancy and lack of confidence.
Mm-hmm.
You know, the WHO, World Health Organization, says that the development of vaccines are the number 2 most important public health advancement of the 20th century, second only to clean drinking water.
Yep.
They now are saying that vaccine hesitancy is one of the 10 greatest threats to the public health. Now check that out.
Yep.
So that's true. So the need for having effective communication, I mean, back in the day, the doctor said, do it. You did it. Okay. Now it's got all these other influences on your healthcare decisions. So that's where we are right now.
And we just had our first 3 deaths from measles this year. Hadn't had deaths in well over a decade. We had 250 pediatric flu deaths this year because the rate of influenza vaccinations going down. Flu vaccine is not perfect, but if you get it, it definitely helps you from having severe bad outcomes. We're seeing kids dying from pertussis with moms that chose not to get the TDAP, and moms are the number 1 infector of their own kids, but they're so freaked out, right? So same thing, people, we will see increased infections from decreased vaccination rates. And again, to Dr. Brooks' point, certain diseases like measles require almost 95% of us to be vaccinated to stop the spread around the community, which is why we now see like 1,230 cases of measles in the U.S., the most that we've seen since 1992, which was the year I got out of medical school. And by 2000, the United States said we had eliminated. Didn't mean we got rid of all of it, but it mean we got the outbreaks down to such a low number that we were in the status called eliminated. And we're now threatening to lose that status because we've seen such a drop in rates and such a big, I think we're up to 35 states or something like that have active cases now.
Mm-hmm. So I know we've been talking a lot about what individual patients and communities can do around, improving their vaccine confidence, but why don't we start to talk a little bit more about clinicians, right? I know you talked about, how clinicians actually are not trained in communication. So let's think about what can clinicians, practitioners do to stay up to date on all the changing vaccine recommendations and, all the emerging data that comes with that.
I mean, first and foremost, they have to be careful of their source of information. So their professional medical society is going to be really important. And how they recommend the vaccine. This is something new that we're seeing right now. Because of the amount of inaccurate information out there, more and more people are coming into exam rooms and they're on guard and they've been impacted by perhaps inaccurate information. As a result, healthcare providers who were heroes during the COVID outbreak, and healthcare providers were dying too, because, they were doing the best they could and fearlessly going in shift after shift, have become targeted for even making recommendations. And so what we're seeing now is healthcare providers are going in a little bit on the back of their heels and oftentimes making half-hearted recommendations because I just don't want to get in the fight. And again, they have no training on how to deal with it. They go into an exam room without any strategy. And part of the training when we give it is like, you can't equivocate. You can't say, do you want vaccines? Because that's like saying, do you want your gallbladder out? It's probably going to burst if you don't take it out.
Right.
Can you see a surgeon doing that? Like, hell no. But and would you say, do you want antibiotics for this pneumonia because it's pretty bad, or do you not want them? Like, no. You would say, you have bad pneumonia. I want to give you 10 days of this antibiotic. You should make a strong, what's called, presumptive recommendation. Like, I will recommend this the same way I would if I was recommending to my family. You have every right in the world to ask questions. That you could say, I've heard that causes infertility, or I'm just worried about it. That's a great time to ask questions. But we're to the point where healthcare providers are burned out. They are rushed to get from patient to patient. And now they're faced with being kind of targeted and beat up. And they are now kind of equivocating because it's just like, I just want to get to the next patient. And I don't know that you're going to get it.
That's unfortunate.
Mm-hmm.
Yeah. So
Yeah,
then, Dr. Brooks, are there
yeah.
specific organizations that you think do a really good job of supporting clinicians with the evidence-based guidance on how to, have those really strong recommendations in the clinical exam room?
Yeah. So again, you're saying strong recommendations. I get back to what Dr. Wolin said. Now, look, you what okay, I see a 6-month-old. Okay. Oh, good. He's rolling over, he's pulling to sitting up, trying to crawl. Excellent, looking good. His weight, he's 14 pounds, looks good. Okay, so he needs his vaccines today. So I'm a order, and my nurse will give them to you. You need to come back in 3 months for routine follow-up. 6 months after that, we'll get some more shots.
Mhm.
So, like, you're asking the question to get information. The information is for a doctor is kind of basic. Okay, we know you need an influenza shot every year. Okay, it gets a little complex. Someone's immunocompromised or certain age and that type. But 90% of your patients, it's basic. So just the fact that you even have to bring that up shows that we're in a strange new world. You have lower abdominal pain on the right and fever and tenderness. Okay, you need surgery for your appendix. Would you like me to do that? So a lot of what we do because we know where do we go to train. We train for this. It is good to have the patient as part of the decision making. If you're trying to have an advance to read what to do if you get terminally ill or something. Okay, let's talk about it. But you don't need to talk about routine care. So we need to get to that point. So if they're concerned, their professional organization, all the major professional organizations have best practices for vaccines. So maybe more into the mainstream will be AAP, American Academy of Pediatrics, AAFP, American Academy of Family Physicians, ACOG, American College of Obstetrics and Gynecology, ACP, American College of Physicians. That's for interns, adults. So maybe we need to get those out there more instead of CDC. People didn't really know a lot what the CDC was. Yeah, that's the government that does science. That's probably what they know. They probably didn't even know the name is Centers for Disease Control and Prevention. It has a whole campus, buildings. I mean, it's huge. It looks like a college with all the buildings. I mean, so there's a lot of science there, but people don't know what CDC is. So we need to move the needle such that there is not all this concern and worry about something that should be pretty fundamental.
Absolutely.
The part that kills me is that, Dr. Brooks and I took an oath to do no harm. And you have people who are playing with people's lives that will take no responsibility when these people become infected unnecessarily, when they get into the hospital unnecessarily, when they get intubated or in the ICU unnecessarily, and then if they die. Every one of my patients that went through any of those things, we were on top of it. We were there with those patients. We were doing everything we could to prevent those types of things. And here's people just trying to convince you or muddy the waters. And so you decide not to do something and end up getting a vaccine preventable disease unnecessarily. And that's unconscionable. And it's the very first thing that Oliver opened up with was we're a victim of our own success, right? It's what's called perceived. It's relative risk and perceived risk. People are scared about airplane crashes, but they're much more likely to die in a car crash. People are scared of shark bites, right? But and you're much more likely to fall down steps and get hurt. And so the problem is, when people don't see diseases anymore, it's easy to believe, is that necessary? What the data shows, because I was just on a call with a group of docs from Texas yesterday, was that the data shows with all those outbreaks and those 3 deaths that occurred, that the measles, mumps, rubella vaccination rates started going up. Because guess what? People were freaking scared, saying, my kid could die. There's people dying. There's people getting hospitalized. I never heard of that before. So Paul Offit says this all the time. Like, we're going to have to see the diseases and see the deaths, unfortunately, to then be motivated to say, oh, it's scary now not to be vaccinated. But for as long as it's like, I don't know, I don't see these diseases, people will judge it, because they have so much inaccurate information coming in from so many sources. And the problem is your healthcare provider's not here. I think they should be. Not every healthcare provider has to be here, but at least every practice has to be here in some way, so people can hear from their practice. Every doc doesn't have to be on. Every PA and NP doesn't. But like in our practice, we had 5 channels. We had a studio. During the pandemic, we went live each week. People were saying, my uncle sent me some crazy article. Can you guys vet this? And they'd send it to us, and we do it live on the show. I mean, we wanted to give people timely information because everybody was hearing everything.
So we're almost at the end of our discussion, and I want us to end with a call to act. So if each of you can share one thing you want every viewer, whether that's a patient or a clinician, to take away from this conversation about vaccine confidence, what would you say that is?
I'm happy to give you my one thought would be healthcare providers must become, they're trusted messengers, but they need to be trained in communication. And when they become better communicators, they can hear their patients and they can help empower their patients. So like what we do with the trusted messengers, empower healthcare providers so they can empower their patients and have good conversations. It might not always end in the way that you want it to, but at least it builds the relationship to hopefully get you to more evidence-based decisions down the road.
Love it.
What I would say is don't fall for the okie doke. Don't hear something that your cousin said, watch on some Instagram 30-second post. Decisions regarding vaccines are major health care decisions. Don't take it lightly. So if you have any doubt, find someone that is a trusted or something that is a trusted source, get the information. And in the end, understand that 95% of people disagree with the 5% of people that are telling you what not to do. Okay. So we used to have a thing. Everyone is out of step in that parade except my son. So every son is putting his left foot forward. Everyone else putting their right foot forward. Oh, all those people are wrong. So don't trust everything that you hear. And if you have to make a decision about something important, like a healthcare decision, like vaccines, get it from a reliable source.
Absolutely. So thank you so much, Dr. Wolin, Dr. Brooks, for your time, for your expertise, for sharing your own experiences, with providing patient care and training clinicians to do the same. I also want to thank Moderna for sponsoring this discussion, as well as VDO for providing the venue for this enlightening discussion. And for all of those that are viewing right now, please join and stay connected to blackdoctor.org for more information on our next chat. Have a good night.
Thank you, Dr. Ward. Thank you, Dr. Brooks.
Thank you. Thank you.
Thank
Dr.
you.
Wall,